name is Dr. Rasa Zarnegar. I'm an associate professor of surgery at Weill Cornell Medical Center, New York Presbyterian Hospital. I went to medical school in Chicago. I did my residency at Case Western Reserve Medical Center. I did 2 fellowships, one in endocrine surgery and one in minimally invasive and foregut surgery at UCSF, after which I joined the faculty here at Cornell. My major focus is in foregut surgery and taking care of patients with problems with their esophagus and their stomach predominantly. Conditions that I usually address are mostly reflux, achalasia, problems with even gastric motility, and also some gastric cancers and so on and so forth. To deal with these problems, the surgical approaches are quite extensive. You can go from very minimally invasive approaches to very open approaches, depending on the disease conditions. Since the advent of robotic surgery, a lot of the more aggressive surgeries which required open surgeries have been performed more minimally invasively and more successfully, just because of the technology allows you to do so much more. So at the CADC and what I do, what we're trying to strive to do is do these procedures that were previously done more elaborately and more open, is to do more minimally invasive and robotic. As such, currently I do probably over 150 robotic cases a year, mostly in these conditions. And most of the patients have a shorter recovery day or a hospital stay. For example, for a reflux patient, they usually go home the same day or the next day, even for achalasias. For people with even gastric tumors, we're able to get them home in 3 to 4 days as opposed to 7 to 10 days when you have open surgery. So the technology has allowed patients to return to their normal lives quicker, to resume normal activities and eating normally much quicker than they were before. And the robot has allowed us to do that, and that's what I focus on. The most rewarding part of being here and being on faculty here is taking care of patients and performing the procedures I do. I do enjoy doing what I do quite a lot. And as part of that, we perform extensive research in what we do also to enhance our daily medical care. As such, the surgeries tend to improve and the outcomes tend to get better as the research endeavors increase.